Item number 12, resolution adopting an alternative opening plan in support of a variance request under CDPHE Public Health Order 20-28 for limited reopening of multiple economic sectors. Susan Whelan, Director of Department of Public Health, and Robin Johnson, our Medical Director. Good morning, Ms. Whelan.
Good morning, Commissioners. Numerous different variance proposals as we follow the process in which El Paso County is given to further expand reopening business sectors. So connecting the dots from the previous time we were here, we had talked about the need to address mental health as well as emotional health, and that is just as important as infectious disease prevention. And we were able to get some allowances for the faith-based community as well as the Cheyenne Mountain Zoo. We didn't get all that we asked for, but we are making progress. Last time I came before you to let you know that we would be developing a more comprehensive proposal that includes numerous sectors of the community. And I want to make it clear that public health does not make decisions in a silo. We have reached out to the business community, we have reached out to business owners, and they have reached out to us as well. And I also wanted to commend your leadership, because I know as well as anyone that you know how the business community is struggling. You are in communication with us every single day through the evening and also throughout the weekend, trying to press forward and do the right thing for El Paso County. So I do thank you for your leadership on this front. And what we have been doing is continuing to press forward in a responsible, cautious manner while we take in consideration the best practices in disease preventions. We monitor the disease spread in El Paso County, and then we do the right thing for El Paso County residents and also with our partners. The big shift today in strategy is that we are going to propose, and public health fully supports this, and we are in communication with our 3 hospitals, that we will go to a percentages based on space rather than putting caps on certain sectors. And that's the big shift for El Paso County, and this is a different shift than the rest of the state is doing. But we do feel, based on the data and in collaboration with all of our partners, and one of the things that we've said all along the way is that public health, we have our lane, we have our infectious disease expertise. However, we highly respect the business community. We have compassion for what they're going through, and they are informing us with their creativity, their innovation, on how they can operate with a broader, comprehensive variance. And so that's the big takeaways today, and we'll get into more of the weeds as we go along. We have quite a number of people, not only from my staff, but also from the business community, to support this variance proposal. Thank you, Commissioner Williams and Cammie and all of you commissioners for the support that you've provided to public health, because whether it seems like it or not, this has been an extremely intense challenge for all of us on numerous different fronts. Not only the novel disease and some of it that we're learning our way as we go, since it is a new novel virus, there's also the challenge of understanding the public health orders. We're on public health order number 6. And if you can, you know that my staff is not flush with attorneys, or that our lane is not interpreting public health orders to translate those to the public. However, we are in that situation, and we are doing the very best that we can. But I will tell you that if you read certain sections of the public health order, you have 5 different people read it, you're not going to be on the same page. So that is a challenge, and so I want to emphasize that we are trying to do the best that we can, respecting the business community and the owners as we proceed. And I greatly hope that the governor will truly take in consideration our variance proposal, because it is different. But ultimately, if you approve it, the governor has to approve it as well and give us those allowances. So I'm very hopeful that that will help, and I have full confidence in our business community in doing the right thing. So the speakers that are going to be up, and we kind of have a few, so bear with us. There's a lot of information and detail to get to. This is the biggest variance that we have proposed yet. We will have our medical director, Dr. Robin Johnson. We will have our deputy medical director, Dr. Leon Kelly, who serves as El Paso County's coroner. We will have our attorney, Lori Seago, get into the weeds of all of the different components of the variance and take feedback, and as we've done before, red line and make edits as appropriate, because feedback is really important, and again, public health does not make decisions in a silo. This is important to all of us in our community. And then we will also have numerous different representation from the business community and owners, as well as Dirk Draper, the president and CEO of the Economic Development and Chamber, where we've worked together on a regional recovery council. We also have some representatives from our COVID prevention policy group, and it's Ted Colas, our chief of the Colorado Springs Fire Department. So we have great support for this proposal as we move forward cautiously and do the right thing for El Paso County. So thank you.
Thank you. And before we get to Dr. Johnson, who's here on this agenda item? If I could just get a show of hands, please. Okay, thank you. And of those folks that are here, who plans on speaking on this item? Okay, great. Thank you. I appreciate that. Just trying to get an idea. All right, Dr. Johnson.
I think with that, I'm lucky I'm going first. Good morning, Commissioners.
You don't get to leave anyway. You have to be here the whole time, so.
I know. As you know, I'm Dr. Robin Johnson, Medical Director for El Paso County Public Health. This morning, I would like to begin our public health presentation by walking you through the strategic road map that is being built by our community collaborative with public health guidance and county leadership. I always forget I have. So our objective is simply to broadly open more sectors of our economy in a safe and streamlined manner. This sounds simple enough, but requires a strategic approach during this pandemic. To first, capitalize on the monitoring in place for early and effective mitigation of any spread of disease. Then translating this information into a meaningful way to educate and empower our citizens, agencies, and leadership to make the most informed decisions. To really understand this, there are a few principles that we're going to go over quickly this morning, and they are listed below, so let's just dive in. So we've discussed social determinants before. These are the conditions in which people are born and where we live, learn, work, play, and worship that influence our health. They are the bedrock of public health. We understand that the focus is huge flourishing and resilience, and that not only our physical health, but mental and emotional health, employment, food security, transportation, and so much more impact this. Social determinants of health are foundational at the individual and community levels, continually integrating physical and mental, emotional and social and spiritual health. Every time that there are guidelines placed in any one arena that you see in this graphic, there are anticipated and unanticipated responses in the other arenas. Public health is monitoring and proactively addressing these responses. From infectious disease investigation and understanding, the key tools of access to care and epidemiologic investigation began over 150 years ago. We then have moved public health into the development across the U.S. of systemically establishing public health capacity in the 1980s, addressing communicable disease, but also chronic disease, and again, beginning to understand and engage the community on social factors that influence these issues. El Paso County Public Health has been an early adapter of what is termed Public Health 3.0 that has taken root in the last decade. This has been a profoundly powerful tool as we have addressed this COVID-19 pandemic locally. It is based on multi-sector community partnerships to leverage our collective impact, achieving together what we cannot do alone. Under Susan Whelan's leadership, our Board of Health and your support as commissioners, El Paso County Public Health has been able to build on our relationships in the community. One example that profoundly represents this cross-sector impact is our Regional Recovery Council, where public health and our economic leaders meet weekly to discuss and problem-solve the impact of COVID-19. The development of our data and analytics office has empowered us to develop trending off of the data from communicable disease and our epidemiologic investigation. This trending will allow us to create metrics for integration of that data into realistic common sense guidelines to engage our community through education in embracing best public health practice while opening the economy. We are continuing to develop leadership and workforce through the essential infrastructure that was added in 2019 from county support. We continue to work with you on creating sustainable funding from state and local revenue streams, grants, and other financial opportunities. Nikki has spoken to this with the CARES funding, the opportunities from our Pikes Peak Regional Office of Emergency Management, and FEMA funding, et cetera. So the next principle that we really wanted to look at is what about this viral infection? And this helps us understand why our preventive guardrails are placed, where they are, when and how we might expand them. Viral infection is a function of load of virus encountered over time. And for COVID-19, that is estimated to be about 10 to 15 minutes of exposure within a 6 foot, so closer than 6 foot of physical distancing. So when we think about this, part of the wearing of a mask in public is to help decrease that spread. We know that a cough releases about 3,000 droplets, which carry virus, at about 50 miles per hour. So we think about the distance that those will travel. They are large droplets, so they're more impacted by gravity and will drop closer. However, a sneeze can release about 30,000 droplets at 200 miles per hour, which is faster than most baseball players or pitchers can pitch.
Way faster.
And those are small droplets that can travel much farther. So during this phase, that is why public health recommends the social distancing that is still critical and the wearing of a face covering in public, particularly when that social distancing is not possible. The second, and this is part of that, even speaking about viruses and why we have recommendations, is that education. And education has always been a linchpin in public health. We keep our fingers on the pulse of what is happening in the community. From youth suicide in 2016 to 2018, to the opioid epidemic that is still ongoing, and now to this COVID-19 pandemic, we follow current data and local trends. By listening to our community, we can respond, bringing the right partners to the table for community engagement, and thereby giving our residents knowledge they need to safely navigate the complexity of emerging issues. As our economy continues to reopen and people are engaging in more activities, we want to continue messages of preventive hygiene and empower people to take steps to protect themselves and their loved ones. And while this message, did it switch? While this message may seem repetitive, until we have effective treatment, a vaccine, and/or herd immunity, these behaviors becoming a mass movement is our greatest weapon against this virus or others we might encounter. So again, we need to frequently wash our hands with soap and water, and when it's not available, use hand sanitizer. Cough or sneeze into your inner elbow, not your hands. Frequently cleans those high-touch surfaces, avoid touching your face, maintain that 6 feet of distancing, and wear your face mask or covering when in public. We're also advocating that you get tested when you are sick and, or experiencing any symptoms, and stay home if you're sick. And this is the last piece of the arsenal from public health. As a trusted partner is tracing the virus to mitigate its spread. So let's talk about contact tracing. It has been in place for 150 years, as noted earlier in this presentation. It is tried and true tool for infectious disease control and prevention of outbreaks. It is a critical part of our ability to reopen our economy, as it allows us to track the virus through cases and intervene with recommendations early to contain any spread, keeping outbreaks small and restricting the numbers and groups of people impacted. So all of this sounds pretty abstract, but it starts with knowing what to do from the level of each of us as individuals. So I am going to ask Commissioner Vanderwerth if I can use you as an example. Let's say he woke up this morning.
I think you should ask the rest of us if you can use him as an example, and the answer is overwhelmingly yes.
Notwithstanding my colleagues' comments, you can use me as an example, okay?
Thank you, sir. You woke up this morning, you have a runny nose and a fever and a headache. Being aware of COVID-19 and the recommendations to stay home when you are feeling sick, you called in to Commissioner Waller to let him know that you are not going to come into the meeting today. So Commissioner Waller expressed his gratitude for the proactive action of Commissioner Vanderwerth, and they suggested then that he follow up with a COVID-19 test. They looked up access on the elpasocountyhealth.org website to confirm the address of a mobile testing site. And Commissioner Vanderwerth went in and got tested. And due to our partners' expansion of this resource, the results will actually come back tomorrow. So we're going to follow our example, and for the case of argument, you have a positive test. I'm so sorry, Commissioner Vanderwerth. But then you will receive a call from Haley, one of our epidemiologists, to let you know that your test is positive, and she will engage you in a conversation. Questions that you will chat about include ones about when you began to feel ill. And we ask when your symptoms started for two reasons: to ask where you have been or may have been exposed yourself in the 2 weeks prior to your symptoms, and also to determine who you, in turn, may have exposed from the 2 days prior to your symptoms to the 10 days after. Questions might include: who else is in your family? What do you do for work? Have any of these individuals been ill? Remember, most of those who are high-risk contacts for you are family and friends and those that you love. It is essential to note that these conversations are HIPAA compliant, meaning that they follow the same privacy laws that your doctor is held to. We can't share the data outside of public health, and by that we mean the small team that is doing the contact tracing and investigation. And here I'm going to just address head-on some rumors that we have heard from public health. First, we are not tracking phones. We only have the numbers to reach out and to call you. Second, we have heard that there are fears that we will perform house visits to require testing, and be assured we are not coming to your door. I'm sorry, Commissioner Vanderwerth. But we don't even have staff available to do that, and we are tracking the virus. We want to actually empower individuals to be able to make informed decisions based on their exposure, their risk factors, and social circles. And third and last rumor is concerned that we might separate families experiencing illness. Public health has a goal to keep families at home for quarantine and isolation. Note that if you do or don't have children, we want to assure that you have the resources to accommodate your needs in keeping everyone at home for isolation and quarantine and together. It is good public health. It is good emotional health for all who are involved. We do continue to emphasize our high-risk groups. There are special considerations due to their risk for more severe infection landing them in the hospital or creating more risk of fatality. And these include those who are 65 and older, as well as those with chronic disease. We include pregnant women in this because by definition, they have some immunocompromise to be able to grow that baby inside. And so we want to especially protect them during a time when their illness could affect another life. We also continue to ask them to particularly be cognizant of what is going on in our community and following the data on the dashboard, making some informed decisions about where they choose to interact and how they choose to interact. And that brings us finally to that public health is working with our Office of Data and Analytics, our communicable disease and epi teams to build on the data we are following. And you can find that again on our dashboard at elpasocountyhealth.org. We're working to extrapolate from and then integrate these trends of incidence, age, demographics, hospitalizations, et cetera. This will create meaningful metrics that allow us to follow the virus, its spread in our community, and its impact. Our goal is to give meaningful guidelines to our citizens to inform their decisions, where to engage, how much to engage, and how to minimize the complexity of their interactions to reduce risks. And this leads us to the next steps in this multi-sector variance proposal that we are submitting to you today for consideration. While we are proposing further reopening of the economy, we ask that our community, with your leadership, join us in a strategic, comprehensive, and streamlined plan. We will need our continued multi-sector partnerships so that we can create a dialed approach and flexibility to adapt that approach based on trends and interpretation of metrics we are seeing. We need everyone to engage in best public health preventive measures. Thank you for your consideration. I'd like to entertain any questions that you might have at this time.
Do we have any questions for Dr. Johnson? Commissioner Vanderwerf.
Thank you, Mr. Chair. Dr. Johnson, your presentation is just outstanding. There's real science in those charts, and I appreciate very much your making that presentation. And as for using me as an example, I guess I have to respond to that a little bit. I think it is important, right? Say we were to follow that example, and there was a determination that someone had coronavirus and public health protocol. That individual, in my belief, and I believe you would respect this, has the right to refuse to answer those questions if that's how they feel for themselves. But I can tell you, since you were using me as an example, I would be very comfortable sharing that information with El Paso County Public Health because, one, I trust y'all, but two, I'm interested in protecting my family, my loved ones, and my friends. So that is how I would behave, but I do believe it is important to continue to respect the rights of citizens that choose, not to share that information. It's my firm belief 95% or more of anybody that were to be contacted would be thrilled to share that information. I can tell you that's what I would do. So I thought I'd give you my response on using me as an example.
Well, thank you for being so gracious about allowing me to use you as an example.
All right, thank you, Dr. Johnson.
I'd like to turn it over to Dr. Kelly. I believe he has some updates for you on a change in the public health order coming down from the state.
Excellent, thank you. Before we get to that, can I just say, I read a post of yours online yesterday or the day before. That was tremendous. Thank you for that.
You're welcome. Thank you, Board, for allowing me to present here today. I presented first here probably close to 3 months ago at a very, very much more uncertain time. And at that point, we were drawing a lot of scrutiny, both within the state as well as around the country, for being one of the top 10 worst counties in the nation for our case fatalities. And at that point, I showed you all the data, and we told you what the plan was. And we said, it's going to be okay, as long as we're calm, as long as we have good leadership, as long as we are steady in our approach, as long as we don't do anything stupid and panic, we're going to be good. You all, Director Susan Whelan, our mayor, our city council, provided that steady, confident, evidence-based leadership, and our community responded. And that's what's brought us here to this moment today to deliver what we've all been waiting for and working for, which is broad, sweeping changes in what will hopefully allow us to, because we have more than earned that right, based on how we've performed as a community, to get the rest of our businesses in our community open. We've taken a lot of great steps along the way. It's been frustrating for all of us, whatever frustration the folks in this crowd have felt, that you all have felt. Trust me, the folks in that room at Public Health have felt that 10 times over, because we were trying to do everything we can to get us how far we've come and where we're going. So I have the honor of being the first to present some very, very good news here today. And that's that on Saturday morning, the governor announced what seems to be the 7,000th amendment to the public health orders that granted, for the first time really, full authority to local public health departments to decide their own fate and their own actions concerning 3 critical lifetime events: weddings, funerals, and graduations. And you all know that we have worked very hard locally to get our kids a graduation. And it wasn't the graduations necessarily that we have all dreamed of, that they have dreamed of, that their parents have dreamed of, but it was the best we were going to be able to do under those circumstances. But as of this weekend and then through today, local public health departments are now granted the power to unilaterally decide what those graduations look like. And so starting this weekend, Thursday to be more accurate, parents and family will be attending their children's graduations. There are two technical challenges to that. One, some of the graduations have already happened. And unfortunately, my time-traveling DeLorean is in the shop, so I can't do anything about the graduations that have already happened. I am one of those parents that were in that same boat with a fifth grader moving on to sixth grade in a continuation that we were all very much looking forward to seeing, that unfortunately we all had to watch from home. But the reality is that it was by Zoom, and some of the grandparents didn't understand how Zoom worked, and they didn't know how to turn the camera off. And we watched one grandma up her nose for about 45 minutes. And we watched another grandpa, not realizing that he was being broadcast to 150 families, making a sandwich in the back in the kitchen. And my parents were there, and their cousins, and we had literally the greatest time of our lives, in tears laughing, that everyone was like, I'm never going to do another graduation again. Like, this is phenomenal. And so it's an example of life has been hard, but you find joy where you can. But that's technicality, problem one. I can't do anything about that. I feel for the parents who have already gone through this, but I hope you still relished and celebrated those kids. But the second technical challenge is that we have 9 graduations between Thursday and Saturday of this week. And so us at Public Health have been working diligently with our superintendents yesterday, and we'll continue the rest of the week to get those graduations in a position where parents can be there. The rules are essentially going to be, how many family members can come is going to be dictated by the size of the venue, right? And the size of your class and how many people you can get in there safely. The social distancing 6 feet per groups is going to exist. And then the biggest challenge is how do you get all these parents and family in safely in groups, seated away from one another, and then out safely. But I have absolute confidence that we are going to be able to do that with our schools, based largely on the working relationship that we have thus developed so far, building up to this moment. And so it won't be easy in the next 3 days to get it done, but we're going to do it. And so we're very excited to be where we are. And now I believe, is there any questions for that?
Any questions on graduations? Commissioner Gonzalez.
Thank you. I just want to thank you for that. That was one of the things. We had been getting a lot of emails. We did get a lot of, supportive emails regarding us having requested and gotten the approval for the graduation for the students. But that was still one of the great concerns was, for the parents, oftentimes it's, just as, big of a deal for the parents, if not more so, and they were missing out. So I appreciate that. I do think it highlights one of the other issues. Sometimes we're not even notified. The Saturday night special, declaration that then you have to work over the weekend, and everybody's working hard and appreciate all that. But it's just those, some predictability or some, heads up notice is helpful. And but I'm glad to hear that. Thank you and for that.
Commissioner Vanderwerf.
Thank you, Mr. Chair, and I'd like to echo Commissioner Gonzalez's comments and express my appreciation for the public health team, because I know that you went diligently to work to review in detail what was issued by the governor on Friday night, so that when we came around to Monday the next morning, we could discover these things about allowing local approvals for graduations, and that gave us decision space in order for local public health to allow these graduations taking place later this week to include the families. And I just have to believe those families appreciate that very much. So just want to thank the team for working through the weekend so that we can get ourselves to a place that allows for this to happen, because you just got to believe, right? High school graduation for a son or a daughter is one of those special moments for parents. And now we've got the capacity to get there. So thank you for doing that.
Commissioner Williams.
This was my Saturday night crisis, so I really appreciate you guys working on Sunday and Monday to get through this. One of these things that you should know on these public health orders, they're 50 pages long, every single one of them. And there's not like a Cliff Notes version of them. And so you're digging through a lot of data, but I will tell you, you've made so many parents happy this morning. I just nearly cried last night when I started hearing from some of them, so thank you very much.
Happy to do it.
Commissioner Bremer.
Thank you, Mr. Chair. Yes, I echo my colleagues' sentiments and huge thanks. And I have to believe that, we say all the time, we know that our health department staff goes above and beyond. And this is a very tangible and visible way that you've demonstrated that you always do go above and beyond, because quite frankly, it would have been easy to say, oh, we have a graduation in 5 days from now, we can't get enough stuff together to do it. But that was not the response from our health department. And I'm so proud that it's not, that you all saw the importance of doing what you could to work directly with the superintendents and make this happen. And I'm super excited for the seniors in our community that will be the benefactors of that and their families.
All right, anything else? All right, you can continue. Or do you have anything else?
I have nothing else. Mrs. Sego's up next, is that right? Okay, all right, more good news.
Thank you. And how many folks are left in the presentation? Oh, no, I think we have Chief Collis.
Good morning, Commissioners. My name is Lori Sego. I'm a Senior Assistant County Attorney with El Paso County, and I serve as counsel to El Paso County Public Health. Before we get started on the actual agenda item, if you'd like, I would like to take just 1 or 2 minutes to go over, highlight some of the changes in the state public health order that have occurred since we last met. We last met about 10 days ago on a Thursday, and since then the state order has changed twice. So I will, and I apologize, I'm reading this from my phone, but I do think it's important to highlight some of the changes because some of them were meaningful. So the first round of changes since last Thursday opened up some additional outdoor recreation opportunities. For example, it allowed the use of playgrounds and outdoor sports facilities for up to 10 people at a time. It opened outdoor pools at a 50% capacity, up to a maximum of 50 people. It authorized recreational youth or adult league sports. So before there were no organized actual competitions allowed, but now that is allowed. You can have up to 10 players at a time indoors or 25 players outdoors. And it opened up gyms, rec centers, and indoor pools to a very limited capacity, which has expanded since, and I'll get to that. A larger variety of identified outdoor recreation opportunities were identified as permitted, including hot springs, Jeep and other guide services, river rafting, things like that, zip lines, rope courses, outdoor climbing walls. It specifically identified some activities that are still prohibited, and those still carried forward to this day to our most recent iteration. Those include gatherings or events of more than 10 people that are not otherwise specifically authorized, adult and youth sports tournaments, rodeos, fairs, festivals, and parades, receptions for more than 10 people. Car, motorcycle, and horse races are prohibited unless there are no spectators and the race personnel maintain 6-foot distancing. And any sporting events except for those recreational sports leagues that individuals can participate in. I think one of the most important changes that has occurred is a move from prohibitive to permissive language for those businesses that are not specifically identified in the order. And what it says today is that if you are not specifically prohibited, or specifically permitted at a higher capacity, you are allowed to operate with no more than 10 people. I realize for many businesses that that's not much, but it does go from that prohibited to permissive language and allow those unidentified businesses and services to open up in that very limited capacity. Since we last met, houses of worship were allowed to open at the state level, up to 50% occupancy or 50 people per room. Our local variance provides greater capacity than that, just to clarify, but that is now open at the state level. Personal services such as hairstyling, barbershops, nail salons, massage therapists, dog grooming, dog training classes, other kinds of individual classes used to have a very low limit of 10 people in a common area. That has been increased to 50% of the posted occupancy limit, up to 50 people in a common area. So that's expanded a bit. The capacity and then finally, most recently, the capacity for gyms, rec centers, and indoor pools has increased to 25% capacity or 50 people in a room, whichever's less. Competitive events such as foot races, bicycle races, and endurance events are now permitted, so long as 6-foot distancing can be maintained and the limit on group sizes, no greater than 10, is observed. As Dr. Kelly mentioned, one of the new activities or events that is allowed are what are called life rites by the state. Those include weddings, graduations, funerals, and other religious rites. They can occur indoors at 50% capacity or 50 people, whichever's less. But outdoors, they simply need to work with the local public health authority, as the school superintendents have done, to determine the maximum capacity for those outdoor life rites. And I think that's all. Those are the highlights I wanted to hit. There are other minor changes, but does anyone have any questions?
Any questions for Ms. Segal? Nope.
Okay, thank you. All right, moving on to the topic at hand, which is the comprehensive variance request before you today. I want to start with a couple of introductory remarks. First, when Ms. Whelan was speaking, I may be the only one that misheard her, but in case I'm not, I just wanted to clarify a statement that I heard her say. She told you all that once you all approved the variance today, that the governor's office also had to approve it. That doesn't mean that the governor's office is required to approve it, which is what I heard. But just in case anyone else heard that as well, I just wanted to clarify that the governor's office has to approve it in order for it to go into effect. It does not mean that your approval mandates that the state must then approve it. So I just wanted to make that clarification in case I wasn't the only one.
You're quite the lawyer.
Isn't it sad?
Absolutely, yeah,
know.
just a little bit.
So I've distributed to the commissioners a red-lined version, and I apologize, Commissioner Bremer, I neglected to email this to you, so my apologies, but I will put it up on the overhead. This is a red-line version of what was available to the public on the website, and I will go through that for the benefit of the public that's viewing today, but I wanted to make two introductory statements. When we left here today, or when we left here last time, our goal was to open up as many sectors as we could that were not already open. We recognize that those businesses that have been allowed to open in a limited capacity may still be struggling. No doubt about that. But our goal for this round was to try to get as many of those sectors open that had remained closed. As we go through this, you will see that since that last time, 1 or 2 of these have been opened in a limited capacity by the state. Gyms is one example. However, our variance request today is requesting of the state that we be allowed to open those businesses at an even greater capacity than what is allowed at the state level. I also wanted to recognize that this variance today does likely not cover every remaining closed business in El Paso County. We recognize that. Our goal was to work with the Colorado Springs Chamber and the Economic Development Council to identify certain business sectors that had been completely left out and try to get those addressed this round, and I think we've developed 8 or 9 of those. But we do recognize that this does not may or may not open up absolutely everything in the county. Having said that, I'll go through it with you. If I can have the overhead, please. So because we're trying to address so many sectors here today, it's a lengthy, and I apologize for that. I'm obviously not going to read it to you, but I'll try to hit the highlights. So this covers those sectors that are identified up there in the title for you, and we will go through them briefly individually. We've got an introduction there that you're welcome to read at your leisure. One of the most important provisions here in this variance request is that request for authority to exercise local control. It's, as Dr. Johnson stated, we are working on a plan to, as some of you may be familiar with the Utah model. That's one of the models we're looking at to inform this plan, but it's a warning system that that lets the community know how we're doing in terms of disease spread, but also advises on behavior for both businesses and individuals depending on the risk of that behavior and the amount of disease spread that we're experiencing, in addition to the level of resources we have at the time to deal with that disease spread. So what this local control is seeking at this time is authority to adjust our local regulations that are issued pursuant to the variance request approvals that we receive, either up or down, depending on that local data and those metrics that we've developed here in El Paso County. I think, to my knowledge, we are the first county to request that, and we'll see how that's received at the state level. Any questions on that?
Seeing none, please continue.
So the next section, it regards or is applicability. It just provides a little more flesh as to what sectors this is designed to apply to. It includes gyms, and the same definition that is used for gyms in the state order is used here, except for bowling alleys. We included bowling alleys as an indoor activity rather than as a gym, but otherwise it reads similar. Number 2, athletic training facilities. As Olympic City, USA, we wanted to call out those athletic training facilities that are used by Olympic athletes and Olympic hopefuls to conduct their training here in Colorado Springs. We called that out separately, even though you will see that the guidance is the same as that applied to gyms, because we wanted to highlight our unique position here in Colorado Springs and bring that to the attention of the state as they're reviewing this variance request. Number 3 is theaters, both movie theaters and live performance theaters. Number 4 would apply to our indoor malls. Number 5 would apply to indoor and outdoor activities, just a broad category of those particular activities that don't seem to be otherwise captured in what's been done by the state so far. Number 6 is attractions, our larger attractions that are unique to El Paso County and that create a lot of economic activity in terms of tourism and employment there. Number 7 is the indoor water park at Great Wolf Lodge. That is also called out specifically because as a water park, it has some unique considerations that we wanted to highlight for the state. Number 8 is libraries, and number 9 are small private special events. B identifies what this plan does not apply to. We highlighted these, or we included these in our local variance request, particularly just for clarity here at the local level. At the time that we developed this document, these were, and they continue to be, items that are still prohibited under the state order. In addition, they also constitute some of the items that have been disapproved in local variance requests that we have been aware of.
Do we know why those have been disapproved previously? What's the logic from CDPHE?
your own question there, Commissioner, the logic from
Logic
CDPHE.
and CDPHE, yeah, well, all right then, fair enough.
I don't know. Why bars and taverns are allowed or are closed while restaurants are not, I don't know. And if Ms. Whelan or Dr. Johnson wanted to address the question, I'm happy to defer to them. I think the concern with arcades and then those other items are simply just the large, uncontrolled nature of the crowd gatherings, is my best guess.
And does, yeah, I'll get to you in 1 second, Commissioner Vanderwerf, but, you know, I know one of the big trends for brew pubs and microbreweries and distilleries and things of that nature is to have the food truck pull up outside and serve food. Does that constitute access to food from a licensed retail food establishment for on-premises consumption?
It does. If your food truck has a license, as it should, then absolutely.
So the message is you got a brew pub, invite the food truck to come out, and you can open up per the order.
Correct. The purpose is for those establishments to act like restaurants, and they do so by offering food from a licensed food establishment for on-premises consumption.
Got it. Commissioner Vanderwerf.
Thank you, Mr. Chair. I appreciate, you know, the clarity in here about what this doesn't include, but to the state's interests in not opening several of these things, I just remain baffled by it because a lot of these are outdoor events. We've been allowing, for example, automobile races so long as the stadiums are empty. So, but you can still do TV, right, with it, right?
Right.
So you could do that with rodeos. So I'm baffled by why it is applied in one case, but not applied in another case to allow for opening. It seems to me like, at least for rodeos, fairs, festivals, and parades, since essentially all of them are outdoors, as long as the social distancing and the other requirements are met, these should be allowed, you know, in my opinion, to open. This isn't really a consideration for this variance today, but it is a statement about, you know, my point that I don't understand why those are not opened, at least in some form of limited capacity. That is baffling to me. And I'll make one additional point with regard to arcades. You know, there is at least one arcade in Manitou Springs that's outdoors. So there's at least one case where even under the concept of arcades, it's not an indoor activity. So there's still possibly an application. That, I think, actually speaks volumes to why this is so difficult. You know, it's kind of a government trying to understand the thousands of different ways that businesses figure out how to become viable and make money. They depending on the specific local conditions and what you can do in those local areas, there's a lot of different ways that companies have figured out, you know, how to survive, how to deliver a product or a service, and trying to shoehorn all of them into, you know, general categories. It just doesn't make sense. So I just have to say I do not understand why these things are not allowed to open at this point, especially considering that similar things have been allowed to open. Thanks.
Understood. And I do want to clarify one more thing to your point, Commissioner Waller, is that if you're a bar, tavern, or a brew pub who would like to open under this provision, you do have to comply with the restaurant variance that we received, so that it's not just you have a food truck outside. You do have to become familiar with and comply with those requirements that are applicable to restaurants as well.
Sure. Commissioner Bremer.
Thank you. I am curious to Commissioner Vanderwerf's point about the Penny Arcade in Manitou, whether, Lori, is it possible that we could consider that a unique entertainment value, as we did with another one there? Could we explicitly say that's a unique situation?
I suppose we could, Commissioner. That would, and I'll defer to Ms. Whelan or Dr. Johnson if they'd like to weigh in. We've spent over a week going through these particular sectors, trying to identify specific concerns that may attach to their business model. We have not gone through that thought process for arcades, so I can't answer you right now whether they could just fit neatly into there or not, or whether we would need to give additional consideration to how arcades are set up, how they operate, how people generally use them, to determine whether there are concerns specific to arcades that would need to be addressed herein. So I'm not sure that it's just a matter of plugging that word into the category. That's just difficult for me to answer on the fly right now.
Certainly, and sorry to throw that at you. I can certainly wait for, everything else has been very data informed, so I don't mind waiting on that, but I did have to just maybe throw out there another creative interpretation, and I appreciate your acknowledging that. But I also don't want to change anything majorly that would put this entire plan at risk of not passing.
And it's a fair question, and I appreciate it, and so thank you.
It seems to me the issue with arcades is all of the surfaces that get touched frequently by many, many, many people, right? It's not like, one person goes and plays one game, one person goes and plays another game. It's constantly bouncing from, different game to game to game, and my guess is that's why arcades are on the list of prohibited activities, but, maybe I'm wrong about that.
I think that's part of it. I think it's also the fact that the state's approach up to now, when you're talking about social distancing, when you've got activities that you can participate in groups, they want social distancing between your groups. So if you show up at an event with your family, they'd like you as much as possible to maintain a 6-foot distance from other families or other social groups that you didn't arrive with. And I think the nature of an arcade is that you go to an arcade and you're all running around and intermingling with everybody that's there, and that may be part of it. I don't know. All right, moving on to Section 4. This contains general requirements for every facility that is listed in this variance request. It is modeled after the general business guidance that's in the state public order under section Roman numeral 2.I. And I'll go through it with you briefly, but I think the bolded language is important. Because these business sectors create enough of a concern at the state level to have not been opened up to this point, what we required is that each facility that wants to open must develop a written safety plan that incorporates the requirements and the guidance in this document. Unless otherwise provided in the document, it doesn't have to be provided to public health. We just want the facility or the business to go through the exercise of putting down in writing how they're going to address these requirements before they open up. It is also a useful tool if an outbreak occurs at one of these facilities to allow public health to go in and review their safety plan and say, you missed this might be an area of concern, or you weren't complying with this that may have contributed to the outbreak at your facility. So it's a way to think of, for the business to put their plan in writing and give it thought before they open, and also to correct any problems that may arise. Overall, each of these facilities, unless otherwise noted, we're requesting that it be able to open at 50% capacity, or whichever occupancy is necessary to maintain those 6-foot distancing requirements, whichever's less, but no numerical cap, unless otherwise noted. So Section 4B implements that 6-foot distancing. Section 4C contains safety standards for the actual workplace or facility itself. Many of these mirror those found in the state order, and I won't go through them specifically unless you would like me to. I will note that C6 was deleted. In the state order, it does say that employee gatherings larger than 10 should be avoided. We took that out because it doesn't make any sense that if you're going to open an indoor space to 50% capacity, that we, on the other hand, say that employee gatherings are limited to 10. Moving on to Section 4D, those contain safety standards for employees and includes things like employees being required to stay home if they're sick, providing accommodations for vulnerable individuals, and suggesting plexiglass guards at registers that I know many of us have seen as we go out and about. Many have already adopted that.
All right, before you go on, I think Commissioner Vanderwerf has a
Yes.
question.
Yes, thank you. So it's to the old paragraph 10, new paragraph 9. This is about 2 or more probable confirmed cases. I just wanted to reiterate something that I've had many conversations with our local business partners here in El Paso County. To every single one of them that I've had the opportunity to work with, which is dozens now, every one of them has told me their goal is not 2 outbreaks or 1 outbreak, but 0 outbreaks. I think that really speaks to the interests that our businesses have in this community to protect their employees, to protect their patrons, and their interest in doing what it takes, perhaps even exceeding, in some cases, some of the requirements that we may be establishing here to ensure that they get to 0 outbreaks. That's what I have heard from so many companies, and I just feel like it was important for me to mention that at this point, that I believe that our businesses really have an interest in making sure that they protect the health and well-being of their employees and their patrons, and I just think that's a great character for those companies, so thank you.
And that's what makes us able to continue to move forward and open things up, is that responsibility. Section 4E contains safety standards for customers and attendees. E1 contains that 6-foot social distancing requirement. E2 has that red line there that adds tape or other markings encouraged not only when people are waiting in line to maintain that social distancing, but also on stairs or when you're using elevators or escalators. For example, I was at an elevator recently in City Hall, and it only allows 2 occupants per elevator. So it's measures like that that are encouraged. Finally, in Section 4F, we wanted to clarify the relationship between this variance and the youth summer camp and day camp requirements. They're pretty self-explanatory, that if you're operating a day camp at your attraction or at your activity, that both the requirements of the day camp and of your business apply. So first, sector-specific safety standards section is for gyms. As I've noted, gyms are now open under the state order, but we are requesting that they be allowed to open here at the local level up to 50% capacity, or whichever capacity is necessary to maintain that 6-foot distancing. Cleaning of any equipment or machines is encouraged between use, and cleaning supplies shall be provided to make that available for patrons to do, to wipe down their machine when they're done using it. Patrons are encouraged to, but not required to, wear cloth face coverings. We understand that you're in a gym to exercise and that it is not necessarily conducive to your health to do so with a mask on. We want sufficient staff to be on site to monitor and assist everyone with complying with their social distancing and cleaning requirements. The red line change there is an added or a new section A8 for gyms, and that it clarifies that while in a weight room or some other, in a spin class, that equipment should be wiped down. We recognize that when you're in a pool, everything's covered in chlorine. So rather than that fixed permanent equipment in pools such as diving boards and ladders being wiped down after each use, we're just requiring that it be wiped down and cleaned and disinfected throughout the day. I really don't want to read through all of these. There are particular requirements for climbing gyms, recognizing that the entire surface of the gym itself is a shared touch environment, so there are specific requirements for that. These were actually suggested by a couple of the climbing gyms here in El Paso County, so we feel like that they're palatable to that industry. Any questions about gyms?
Commissioner Vanderwerf.
Yes, thank you. I don't know if it might be a typo. The old paragraph 13, new paragraph 14 under B, customer information will be maintained, and I believe, you can correct me if I'm wrong, but I think in other parts of this variance request, the word encouraged is used. Is that correct?
It is. I will tell you that it is the industry that suggested that language. In addition, I believe, I've only been once, but I believe in order to go to a climbing gym, they take that information anyway. I'm not sure that you're just allowed in without providing your name and signing a liability waiver, things like that. So I think it's collected anyway, but this language is what was suggested by our local industry.
Okay, thank you.
So under B, we've added that, again, that language that highlights that Colorado Springs is Olympic City, USA, and that it's important that if the state is inclined to disapprove our request for gyms, we would like them to consider very strongly allowing it, at least for these athletic training facilities, so that we can continue to serve our Olympic athletes. And that's why we called this section out separately from gyms. And as you can see, the guidance for athletic training facilities is the same as it is for gyms, including that added language regarding the fixed permanent equipment in pools. If there are no questions, I'll move on to section C for theaters. Theater, I think the specific risk for theaters is that you're sitting in a confined space for a couple of hours indoors, and so for theaters, some of the sector-specific requirements include identifiable seating, and that it does contain that language of encouraging, not requiring, but encouraging collecting contact information from one member of each group and identifying where they're sitting. It contains that social distancing requirement as well. Theaters are required to clean and disinfect between showings or performances. Congregating in common areas is prohibited. And then with respect to live performances, we wanted to address the performers that are actually on the stage because they're engaging in singing or dancing or activity that would expel the virus to a greater extent than just sitting and normally breathing would. So what we're requesting is that those live performances be limited to 10 performers on stage if they can't maintain that 6-foot distancing due to the nature of the performance. If they can, if it's a musical performance and the musicians can spread out, then we're requesting up to 25 performers on stage. And the caveat there is that if you're not on stage, you still need to maintain that 6-foot distancing if you're a performer. Any questions on theaters? Moving on to our indoor malls, the way that the state order reads now is that indoor malls, the interior area is closed. If you're a retailer or other service that has an outdoor entrance directly to the outside, you are allowed to be open under your particular sector's guidance. But if you only have that interior entrance, you're closed because the mall is closed. So what this would do is open up those indoor malls so that those other services and retailers can open. Trying to identify or address what we perceive the concerns from the state will be. We would require that any feature that encourages group gatherings, such as the food court or large seating areas in the mall, be removed. However, some individual seating would be left in strategic areas for those who may have physical limitations and need to sit down and take a rest. On-premises seated consumption of food and beverage, so meaning those food courts, is prohibited. However, if an indoor mall wants to open a food court, they can obtain approval from El Paso County Public Health for a written plan of operation so that they can meet those restaurant requirements as closely as possible. And then you can see the two other measures that are included there for the indoor malls. Any questions on those?
This is Commissioner Bremer, just with a quick comment.
Go ahead.
I just wanted to reiterate what our clerk and recorder Chuck Rohrman said earlier in his presentation, that he is counting on the outside entrance areas to still have his voter centers open in the malls, and I think that's significant. And this also opening up the interior goes a long way for ensuring that access and really public facing piece that reminds voters to vote. So I think we can't talk about indoor malls right now without talking about what they do in our community, specifically as it relates to voter and clerk and recorder services.
Thank you. Section E pertains to indoor and outdoor activities, and again, this is intended to encompass some of those activities that do not seem to otherwise fall in what is now permitted under the state orders. Examples are listed. It's not an exhaustive list, but it includes things like our nature centers in the park, bowling, ice rinks, laser tag, indoor gun ranges, which are still closed even though outdoor gun ranges are open, escape rooms, miniature golf, go-kart tracks, paintball. And contains requirements for those, and things like cleaning of any business-owned or rental equipment that may be distributed to participants between each use, frequent cleaning of high-touch and common-use items, encouraging reservation systems to make sure that different groups aren't mingling as they're waiting for their turn to engage in the activity. I have one correction to make here on the record. So you can see that pool halls is redlined here because we had initially included it because of the activity of pool or billiards. However, we're not sure if there are any of those that exist that don't have a liquor license and would be otherwise qualified as a bar or a tavern. So we decided to take that out because if they have a liquor license, they need to follow those provisions. If they're a pool hall without a liquor license, they would still fall under this category because, again, this is not an exhaustive list, but we thought by removing it, it would reduce that confusion regarding whether or not you have a liquor license. And because we did that, though, we would need to cross that out there at the beginning of 5. So I would ask that any motion that's made here today include the deletion of that language. So that would be, no, that would be...
Removing it here, but adding it back in the other one, or still only
we
if they have the...
We just wouldn't call out pool halls in general. If you're a bar and you got a bunch of pool tables, you're under the bar regulations where you have to act like a restaurant. If you're a pool have a liquor license, then you would fall under this category anyway. We just wouldn't be specifically calling it out as an example to reduce that confusion. So we're not proposing closing them or keeping them closed. All right, so if you're participating in laser tag, Nerf gun battles, or those competitive indoor or outdoor activities, we just aligned that guidance with the Youth Sports League guidance that has come out. And so if you're doing indoor laser tag, you can have 10 people in there at a time engaging in that activity. If you're doing outdoor paintball, you can have 25 people engaging in a single paintball competition or event. Any questions about indoor and outdoor activities?
No, but I would ask this question. Do you think we're getting fairly close here? And the reason I'm asking is it appropriate to take a break now and then come back and finish? Or you know, I see a couple more pages, but a lot of red lines here.
I can probably wrap it up in about 5 or 10 minutes, Commissioner,
Okay.
So up to you if you want to take a break.
Why don't we go ahead and continue then?
So indoor and outdoor attractions is our next section. This was an area of big concern, obviously, for our Economic Development Council and our Pikes Peak Attractions group. This, again, provides some examples of what are considered attractions, and I noticed another error, and I apologize. I'm going to cross out nature centers because it's specifically identified as an indoor activity. So we don't want to be duplicative and confusing there. But it includes museums, Cave of the Winds, Manitou Cliff Dwellings, the Santa's Workshop Amusement Park, and the Flying W Ranch would all be considered examples of these types of attractions. This is one of the sectors where an individual safety plan does need to be approved by El Paso County Public Health before it can open. The reason for that is that these are large, complex facilities. Each one of them is unique in terms of what it offers and how, and we just want to make sure that thought has gone into each segment of each of these attractions. So that written safety plan has to address the general requirements that we discussed earlier, as well as these additional requirements. Because we added language that specifically identifies the Santa's Workshop as being included in this group, you'll see added paragraph 5 there that requires that, that those rides be cleaned and disinfected at the conclusion of each ride cycle, and that hand sanitizer be provided for those that are riding. Any questions about this section? Section G specifically calls out the indoor water park at Great Wolf Lodge. To my knowledge, at least, it's a unique attraction here in El Paso County, and we don't have, it's the only large water park that we have. So it's got its own requirements. The CDC has a website that is specific to aquatic venues, and so much of this, much of these requirements are pulled from that. I'm happy to answer any questions about those specific requirements.
I don't think we have any.
Moving on to libraries. Libraries are currently allowed to offer curbside pickup, delivery, window pickup, things like that, but they're not, the buildings themselves are not open to the public. So the idea here is to open those up to the public because they do provide a number of services in addition to just circulating written reading material. Any questions there? Okay. Our last one is small private special events. So these are private special events. Right now, the state order does allow, just recently opened up some of those, your weddings, your funerals, your graduations, and other religious rites. This would open up other things like family reunions and other types of just, great big family barbecues or things like that. In indoor venues, those private special events would be limited to 50 participants or 50% of the venue itself. But for outdoor venues, we took language from the state order itself that says you just have to work with El Paso County Public Health to determine the maximum number of people in your outdoor venue depending on which venue you're using and how you're sort of cordoning off your particular event. I will tell you that El Paso County Public Health is in the process of developing guidance for determining capacity of outdoor events, not only for this variance, but for those that are listed in the state order as well, the church services and the life rights, so that we are not approving, other than what's in this variance, your individual wedding event, your individual life right event, your individual church service. Because the state put the burden on us to approve that occupancy, we are developing guidelines for that, and as long as you are following that, then that would be what we would approve.
Commissioner Vanderwerf.
Thank you, Mr. Chair. It may be premature to provide an answer to this, since you mentioned that you're providing guidance, but there certainly are families that, if they were to have a family reunion, would be asking for more than 50 people. So is the concept behind that you're going to establish guidelines that would allow to go past 50, but there would be some kind of additional requirements. And it's really just the question about, like in most cases, probably 50 is fine, but in some cases, it just might be bigger, because there are venues in the Springs that can definitely go way past that and still stay below 50% occupancy, and some families are big families. So what's the thinking for that?
So you are right. Well, the guidance would apply to outdoor venues. In terms of indoor venues, what's being requested here, as you noted, is the 50 individuals or 50%. The thinking there, as I stated at the beginning, is to open up some of these activities and businesses that have been completely closed up to now. And to do so in a way that we are hoping creates the greatest chances of success at the state level. So we could ask for something more and see if the state brings it back down, but we thought that that was based on the other approvals that have occurred, the other things that have been approved, gyms, restaurants, are all limited at the state level to 50 people. So we thought that that carried the most chance of success. Okay, there is a second part to this plan that I'm not going to go over. You've seen it before. It's our disease response plan, and it provides a lot of information about how El Paso County is well poised to respond to the disease as it currently exists in the county and any increase that may occur due to opening these sectors back up. And I'm here to answer any questions you may have.
I think we have covered those thoroughly.
Okay.
Okay, so what we're going to do is take a break now, and then when we come back, we'll get to Chief Colas, and then I think that's the end of the official presentation. Do we have somebody else in the official presentation? Okay. So we have a couple people. Then what we'll do is open it up for public testimony. What we'll do is we'll take people that are in opposition first. Can I see a show of hands of people that are in opposition to the variance? Okay, we have one in the back, one over here, a couple, okay. How about people that are just sort of don't know where they are on it? We'll take them second, and then folks that are in support of the opposition, or in support of opposition, no. Folks that are in support of the variance we'll take last, so. All right, we're gonna stand in a brief recess. We will reconvene here in just a bit. The meeting will come back to order. We're considering agenda item number 12 right now. I think we left off with Ms. Sego had just finished the legal presentation. I know we had a couple of other speakers as a part of the program. I think the next is Chief Colas.
Thank you, Mr. Chairman and members of the Board of County Commissioners. Ted Colas, Colorado Springs Fire Chief. I just want to say that when the response first started to COVID, I was invited to be a part of the policy group with Director Whelan and her staff. And I want to let you all know, I think you already are aware of this, but I'm very grateful for that staff and the way that they work. They are very driven by data, but they've got a very firm focus, and that focus is the health and welfare of our community, and we're all very grateful for that. It's been an honor to be able to work with them. Just recently, Director Whelan reached out to me and talked to me about this broad variance and the specifically about occupancy loads and things like that, and we were able to have a conversation. I'd like to just let the board know that I think that this is a very thoughtful approach. It's a very trusting approach. It trusts our business owners and managers to make decisions that are in the best interest of their employees and of their customers that will be frequenting their businesses. I think it's a very responsible thing to trust our business owners to make those kinds of decisions, and with the health department to be there in support with education and with guidance to help them make proper decisions along the way. I'm very grateful to be in support of this variance request, and if you have any questions for me, I'd be happy to answer them for you.
Thank you. Are there any questions for Chief Colas?
Thank you.
All right, who do we have next?
Hi, good afternoon. I'm Dr. Gloria Winters. I'm the Chief Medical Officer for the YMCA, and I'm here to represent gyms. There are many things that we don't know about COVID. We don't know the longitudinal impact, the surges and trends that will occur, but what we do know is that we are walking a tightrope between healthcare and economics. We know that we need a place that people can go to that they trust. a place where people can work to boost their immunity, decrease infection severity, prevent chronic disease, and improve their behavioral health and wellness. What we can do is implement El Paso County's strategic guidelines, which are safe and streamlined, that allow us to provide a place to improve the health of body, mind, and spirit, while mitigating the disease. I thank you for your consideration of this variance for gyms. You can trust us to provide a safe environment, which will also allow us to improve the health of our community. I would be happy to answer any questions about the policies and procedures we're putting forth in order to reopen our gyms.
Thank you for that. Any
Thank you.
questions? We appreciate all the thoughtful consideration. Okay, now we're going to go to public comment. So if you're somebody that's in opposition, we'd like to take opposition now. I know there were a couple of people, but I don't see them now. Oh, sir, yeah, please come on down.
Could someone show the page that has the list of the COVID virus symptoms on this plan? That page? Deborah Stout-Meininger, community advocate, citizen scientist. This list for the protocols to monitor employees or customers in and out of businesses, this list is missing another set of symptoms for an associated syndrome called the that's what they call it in the US, multi-organ inflammatory syndrome, related to the COVID virus in children. So far, it's been, not counting what's going on in England, here in the United States, from what I've seen in the news media that's out there for public information, is that it has victims 4 years old to 19 so far. And when they're seeing them is when they're in the end stages of the symptoms for this particular, we'll call it that at this time, because it is a matter of them having the COVID virus, but instead of just getting over it, they are going to a secondary level of it, which is the antibodies from the COVID virus attacking the blood vessels in the body and therefore the organs in the body. There is a whole list that needs to be on there for that particular syndrome to also be watched for. Otherwise, we are like the Titanic, going by the tip of the iceberg and then crashing down the road because we didn't know what was going on underneath the water. And that's what this is in that category. We don't want to be a Titanic when we put this in only and not that other information. This would be for heart failure and the respiratory distress is when they get into the ER, and that is very similar to the elderly when they have a baseline that they're ill and they start to get better, and then all of a sudden it takes a turn for the worst. They're in that same category if they have had vaccines, at least in 2019, maybe 2018. And those children that got the vaccines for the flu vaccines in 2019, where it was so pressed so hard, that is also a group that is at risk for this, because those are the ones that are going into that next stage, like the children. There is skin rash, inflamed skin, dry lips, red inflamed eyes, inflamed swollen fingers and toes, swollen tongue, lymph nodes, inflamed membranes in your mouth and in all your tissues attached to it, damage to brain, liver, lungs, and heart. This is ongoing damage that is being done by those rabid antibodies from the COVID virus. And I don't think it's being caught in the elderly because we've been categorizing them in that second, had COVID virus but died from other things, because they're not all the symptoms that are for the COVID virus. If we put this out without that, we are doing a great disservice for the children and for our emergency crews who are also going to use this list.
Okay, thank you.
Good morning, Commissioners. I appreciate the time to speak to you, and I do want to say I don't want my comments to be offensive to any of my brother and sister small business organizations. There's wording in here that I'm concerned about. I've asked the attorney to leave this sheet up because those are two of the things I'd like to reference. May 28th, I appeared before you and asked for an application to include gyms. That day has come. Unfortunately, today I'm here requesting that gyms be removed from the language of this alternative opening plan. We reopened yesterday under Colorado Department of Public Health and Environment's approved guidelines that were issued last Thursday that have been referenced. We're in full compliance with those directives, and our members are understanding of the directives with an understanding that they will change in the future when this goes away. Unfortunately, Exhibit A today provides an is overly invasive and requires a lot of institutional changes and considerations in addition to what has already been approved by the CDPH. This time I'd like to show just a couple because I know time is short.
I tell you what, sir, you can slow down. I'm going to give you a couple extra minutes since you seem to be the person carrying the water here for the
I had
opposition.
To run to change my meter, so I think we've got the heart rate still up here. So one of the specific ones I'd like to point out, if we could bring the screen up, it requires us to have protocols to monitor employees for symptoms must be implemented. And again, it's the word must. Cough, shortness of breath, fever. The ones that, to be honest with you, I'm in the business of shortness of breath and muscle pain. If I have to monitor employees for that, and it says I must monitor for them and implement protocols for it. Another one, quite honestly, that concerns me is headache. Most of my employees are between the ages of 19 and 35 and have self-induced headaches that aren't necessarily COVID related, but I don't want to have to establish a protocol to, and I've also done it myself in the last week, quite honestly, but I don't want to have to develop a protocol to do that. As we move to item 8 below, it says if an employee reports or exhibits any of the above symptoms, I must take all of the following steps. Not I may, I must. Send the employee home immediately. I have 3 employees on staff. Somebody comes in and says, well, I had too much fun last night, had a headache. I have to send them home. And then on C, I have to exclude the employee from work for at least 10 days. So again, I think the intent of the document is proper. I think there needs to be some fine tuning, and I'm trying to look at this for all gyms, not just specifically for me. Different sheet that we have here, another one that caught my eye. Actually, and that continues on to me having to post a sign at my entrance to allow my participants to know also. They're supposed to self-identify those items, and if they identify with any of those things, muscle pain is a real common one this morning because we were open for the first time yesterday. So a lot of them have muscle pain. According to this document, they're supposed to go home. Another one I'd like to point out is the stationary machines and equipment. This is on page 5, section V, item A2. Stationary machines and equipment, and I'm going to paraphrase, must be separated by a minimum of 6 to 12 feet. I'm not sure if it's 6 feet or 12 feet. Either one is tough. Adjacent machines and equipment closer than 6 feet must be blocked from use. The state requires 6-foot social distancing, which is what we provided. Treadmills, real simple example, 3 feet wide. So I have somebody on a treadmill, vacant treadmill, and then the next treadmill is being used. They are 6 feet apart. This is the machines have to be 6 feet apart. So if I look at the edge of the treadmill, another treadmill is 3 feet, a second treadmill is 3 feet, and it's not until the fourth treadmill actually that we get to the 6 feet. So I'm concerned about the overly invasive nature of this. And the exact same thing applies to lockers. It says lockers every 6 feet, lockers in use. I'm not sure which ones are being used unless I have an employee standing in there watching which ones are being used. I have a lot of lockers. I've got 120 lockers in the men's locker room. Having said that, they're stacked lockers, which means I have 60 lineal feet. If I have one locker used every 6 feet, that's allowing me to use 10 lockers out of my 120. I don't believe that's the intent of the language, but at this point, I would much prefer to continue under the state's guidelines than under this document. I just want to follow the law, and this would put a lot of constraints on our particular business, and I think in most gyms' business. So I appreciate your time. Thank you.
Thank you, and maybe Ms. Seago, do you want to address any of this now?
Just a couple of items, Commissioner. The employee monitoring protocols, that's required by the state as well. That's required for every single business and every single government function. We do that here at the county. And I was trying to pull it up on the website real quick, and it's not very helpful to put my phone on the overhead, but if we want to give it a shot. Right here, this is the 6th amended order. It's the most recent one. These provisions haven't changed for months. This applies to all businesses, and it's an employer requirement, and it requires symptom monitoring protocols and requires a list of steps that must be followed if you've got someone who screens positive for one of the symptoms. This particular document does not have the list of symptoms, but it's elsewhere on the CDPHE website, and it mirrors the one that we're including in our variance request. I couldn't pull it up before I approached the podium, but it's on there as well. So we're not doing things that are very different from the state when it comes to these generalized requirements.
Commissioner Vanderwerf.
Thank you, Mr. Chair. So appreciate, knowing that this exists here, as you just indicated. I do believe there's some other kind of considerations from the gentleman, right? So shortness of breath is actually a function of exercising hard. And muscle pain can come from also exercising hard or over-exercising, maybe from the day prior or something like that. So I appreciate his interest in doing what he can to fully comply, but those do seem like things that we wouldn't have a concern about. So how do we address that in the language, or is it that we've decided to interpret the language to not include that? I mean, how do we kind of try to figure out how to address those questions from him?
I would defer to Dr. Johnson if she wants to provide any specific medical advice, but my recommendation would be to just use your common sense. I don't advise making any changes to the language, but if you've worked out the day before and you're sore and you recognize that you're sore from the day before, use common sense. But if you've got muscle aches that have come on suddenly with no apparent other cause, and then that would be something that you would screen for. If you imbibed a little too much the night before, you've got a headache the next morning, use your common sense to attribute that, to distinguish that from a headache that has no other apparent cause. And I encourage Dr. Johnson to correct me, because I'm certainly not a medical professional. I have no medical training, but I think you've just got to inject a measure of common sense into these requirements.
Well, but I think what he's saying is the language doesn't allow you to do that technically. If exhibit one of these, you have to take the following steps, which are sending them home immediately and sending people to get tested.
So I would actually reiterate what Lori just said, that there is some common sense applied here. We use this common sense all the time in the way that we seek health care. So if you have been in, over imbibing and awake the next morning with a headache, most people will take a Tylenol and drink a big glass of water and make the decision to go about their day. These are the symptoms that can present for COVID. Not every cough is COVID, and so we are monitoring this with our individuals and with patients. And so, these are complicated times, and we're trying to give really strong guidelines to help people make wise decisions, but at the same time using some common sense. I certainly am not going to kick you out of the gym because you develop shortness of breath because you're on the treadmill, because most of us are there so that we will get shorter breath, so that hopefully we can increase our lung capacity. I think that Dr. Kelly is stepping up because he probably has more to add. So
can we have a brief powwow here?
Yes.
So we're just discussing that we can add the term unexplained to right in front of it. Protocols to monitor employees for the following symptoms must be implemented unexplained, and then it will go through the symptoms.
Excellent.
So that there's some of that common sense, and I think it allows for what we, Ms. Seco and I have been discussing, and it gives the terminology so that there feels that there's that legal foothold.
Perfect.
Could
Thank
you state again where we're adding that word?
Yeah, I'm writing it in right now.
Okay, then I'll make sure it's in the motion.
Any other questions or concerns about that?
No, I think that addresses it.
Thank you.
That can't be otherwise explained.
So it would say protocols to monitor employees' symptoms that can't be otherwise explained must be implemented. So if you've got allergies and you've got a runny nose and a cough, and you know it's from allergies, that would not exclude you.
Perfect. And I got a thumbs up, I think, in the back that addresses the gentleman's concern.
I just have one more question,
Yes.
Mr. Chairman. In the case where, so obviously we have a gazillion state orders and we have county orders. In the case order is more flexible, do they have to follow our local order or the state order?
So what we've been, the answer to your question is they would follow the least restrictive. What we've been doing is every time we get what we've been trying to do, it's hard to keep up. Every time we get a variance approved, we're issuing a local public health order. We're comparing what we got approved with what the current iteration of the state public health order is, because sometimes it changes between the time we submit our approval or request and it gets approved. So we compare everything. We make sure we're implementing the least restrictive provisions, and we issue a local public health order that contains in one document what that sector needs to follow.
Thank you very much, because I do know, in my experience with the business owners, everybody's just really trying hard to comply.
I know, and you've
I
got
know that you
guidance
know that
in
too.
72 different places, and most of it conflicts, so I understand.
Commissioner Vanderwerf.
Thank you, Mr. Chair. And Lori, this is not for you. This is for the gentleman in the back that just testified. Just want to say thank you. That's actually the importance of having citizens come here, because if there can be a better way to do these kinds of things, that's why public input is really critical. So I just want to express my appreciation for your coming and making that offer, and also your interest in complying with it and how to do that best and have a good interpretation of it. So I appreciate that you came.
Okay. Do we have anybody else that's in opposition to this that would like to speak? Yes, sir. Please come on down.
Thank you. I'm Tom Haggard from Santa's Workshop. I'm not in opposition, but I would like to consider an amendment to it. So I don't know if this is where I talk or
yes, sir.
If I could have a copy of the variance.
Just go ahead and put it up there. They'll put it on the overhead. Oh, yeah. Maybe you should just stay up here, Ms. Seco.
Do you know what page?
Just over here where Santa's Workshop is listed.
I'll get you.
Okay, my objection is that we're listed as Santa's Workshop Amusement Park, and I don't consider us Santa's Workshop Amusement Park. I consider us Santa's Workshop, and as an outdoor attraction. I'm not opposed to the language as far as the rides are concerned. What I'm concerned about by saying Santa's Workshop Amusement Park, that I'm going to become a target when it goes up to the state for more looking harder at me than maybe anybody else when you have a label like that as opposed to just Santa's Workshop. But the language as far as the rides are concerned and the extra safety procedures and all, I'm very much in favor of. I just wondered if you could list me as an attraction, and then take the part about any attraction that has rides or whatever has these same procedures, because there are attractions other than Santa's Workshop that have amusement rides. That I don't know where they're covered in here or if they are or not. So I'm just opposed to being labeled Santa's Workshop Amusement Park, and hope that maybe it can be changed where you can still have all the safety things you want without that in there.
Commissioner Vanderwerf?
Yes, thank you, Mr. Chair. Sir, I appreciate your coming and fine. You know, I didn't know that you were in the audience, but I guess that if you were reading through this, that we might have gotten a comment from you about those two words, because you and I have talked extensively about
Yes,
that, right?
Yes, sir.
It might be, since there is treatment for amusement parks specifically identified in this section, and that is the new section F5, it seems to me like in the upper section where it's giving examples, the names of the companies are actually referenced there. Cave of the Winds, Manitou Cliff Dwellings, Flying W Ranch, but there's nothing after the name of the company that says Flying W Ranch, Entertainment Center and Restaurant, right? So I would like to maybe ask if Public Health would be willing to remove the words amusement park in that section. And, you do have some small rides, and they are licensed by the state, so when the state does its review, they're going to know that you have some licenses for some small rides, most of them kiddie rides, little things. So they'll be able to make that determination when they do their review of the licensure that they hold. So I have this question to the team. Thank you.
Thank you. We are okay with removing amusement park after the name of the facility.
Perfect. Okay, very good.
Thank you.
You're welcome. Is there anybody else in opposition that would like to speak to this? How about those that are kind of on the fence? Anybody like to come down and speak that way? Yes, sir. Come on down. And if you could, please state your name. And I think I have not been diligent at asking people to state their names before they begin speaking. We need to do that for, to maintain the public record, know who's talking and who's not.
I'm Nathan Newbrow, and I'm the CEO of the Colorado Springs Philharmonic. And I'm not in opposition. I'm not even on the fence. But this way, I got to go first. But I am.
You heard it here, folks. The guys from the Philharmonic. All right.
I'm joking. No, I thank you for taking a break, because it did give me a chance to speak with leadership from Public Health, and I got to have more than an hour of Dr. Johnson's time last week, and I appreciate her for that. We learned a lot from that conversation, and I think this is the right thing to pass. It should pass, but perhaps this is an iteration, and the next iteration can be improved, and so I'd like to give this feedback. The nonprofit arts represent a $166 billion industry in the United States. The economic impact is huge, and so far the impacts from COVID have been more than $4 billion, and that number will climb. The performing arts especially was the first to get cut off, and we're going to be the last to return in full numbers. And we know that in the middle time, it's an opportunity for us to be innovative, and this gives us a pathway to be innovative, and we appreciate that because it gives us some thresholds to work with. I will point out, though, that on close inspection, it seems to me that the 6-foot distancing requirement that's required in theaters is inconsistently applied to the other business sectors. And so you have spacing of gym equipment, which I can appreciate, but you don't have the mandate that the people be distanced. You're really, the implication in here is that those people are using their best judgment, using their own self-determination to distance, just as we are here. The biggest surprise for me walking in this morning is that I was not told where to sit. People here are distancing to the extent that they are comfortable, and you'll notice that they're not very distanced. This is about a 200-seat theater that we're in right now, and if we apply the 50% rule, that means 100 of us can be here. Great, there are about 72 of us here. If you applied 6-foot distancing between groups, my estimate is that 40 of us would have to leave, and the rest would have to be reseated and told where to sit. And so imagine running a business around that, and you will understand that at the Pikes Peak Center, those kinds of numbers won't work. The rough estimate there is about 18% if we're doing a full 6-foot distance in between groups. 18% won't work. 50% of the total capacity will work, and so we hope to have some middle ground, some parity between the different types of business sectors. We understand, though, that public health is not equal to fairness, and so we get that. We're not asking for a special dispensation. We are asking for some reconciliation between these different business types.
Thank you. Are there any questions for this gentleman?
Okay, thank you very much.
Thank you. All right, who would like to go next? You seem excited.
Hello, my name is Lauren Grabowski. I'm a recent graduate of Coronado High School, just class of 2020. I'm a competitive diver getting ready to go off to college, but I'm here to speak in favor of the amended section. Thank you, Commissioner Bremer, for amending the language to include fixed equipment in indoor pools such as diving boards and diving platforms, because I want to speak a little bit about how that will impact my team and I. A couple of my teammates were here earlier, and we were going to speak about how this was important to us because we have missed opportunities this past summer, such as one of my teammates, she was going to go to an Olympic qualifying event in Arizona in April, but that did not happen. And USA Diving is still planning to hold, as far as I know, winter nationals, like senior winter nationals this winter. And if we aren't able to train for events like those, that's very much a missed opportunity. And not only does diving allow us an outlet for physical exercise, but it also allows us an outlet for helping to improve our mental health. I know that in 2018, I went through a pretty severe flare-up of my anxiety disorder, and diving was one of the largest contributors to helping me manage and get myself through that and to come out on the other side stronger. And I know athletes around me, many athletes, especially in sports where they cannot practice right now due to the need of specialized equipment such as diving boards, are struggling a little bit to find an outlet to help occupy themselves, such as diving for me. And I just want to make sure that those athletes are supported and feel that once they get to practice again, they can practice again, and I'm in support of that. So yeah, I think that is all I have to say at the moment.
Thank you for being here. I got to tell you, diving I think would be anxiety-inducing for me. You know, there is no way I could stand up there and dive without tremendous amount of anxiety and harm to my body. Are you? I'll get to you just one second, Commissioner Bremer. Are you going to be going to school? Or are you going to be diving competitively in school?
Yes, I am.
Good. Where are you going?
Boise State University.
That's awesome. Well, hopefully you'll get to experience a lot of great opportunities there, and that'll hopefully be some recompense for missing some of those opportunities here. Commissioner Bremer?
For being here, sharing your story very transparently, and especially when I know you're eager to get back in the pool and there was an 11:30 practice. So I think it speaks loads that you, there's nowhere else you wanted to be over the last few months than back in the pool and back on a board. And you chose this morning to come and tell us how important that was to you. So just thank you for your time, and hope you make the second part of that practice.
Well, thank you.
Commissioner Vanderwerf.
Yes, and I also would like to thank you for being here. There's no need for you to come back up to the podium, but you know, in addition to going off to college, being a young adult now, now you have participated in civic life in the community as well, and I'm proud of you for doing that. Keep doing that, because you'll be thinking hard about how to make any community you live in to be a better place, and this kind of a process is one of those devices for how to do that and to contribute to it. So thank you for being here for that reason as well.
All right, who's next, please?
My name is Nikki Myrie, and I'm in behalf of the Citadel Mall because we are still closed. And I have to start off saying I am so discombobulated this morning because all through the first part of our meeting, this podium was only cleaned once, and everybody came and touched it. The things that you're keeping us closed about. This meeting, everyone talked on the break. People weren't wearing their masks. They were up in each other's face, but yet we can't open because you're worried about that. When we go into losing our business, no, we don't. We apply for the small businesses loans, but we don't get those loans. Why? Because the bigger people are getting them because we don't have 20 and 50 employees. Give us the opportunity to willing to just try. We will comply with everything we're possibly. I am one of the few who is allowed to do so, but we keep our stations clean. We keep our gloves. We do the 6 feet. We are down. I am down from 20 employees to 4. My other employees, because we are still closed and I have nothing to say, they go get other jobs. So even when we do reopen, we don't know what it's going to be like. It was hard to sit here and laugh at some of the things that were funny. Graduations and festivals and I would love to do all that, but most of us sitting here, we don't have the money to do that. Why? Because we're not working at all, period. I even stepped down because it's not enough room. So all the things that everyone's talking about, I'm so confused. I'm like, why is it that the mall can't open, but yet everyone that's up here talking earlier all have jobs? You guys all have jobs. What would you be like, Sir Chairman Mark, if you were on my side and I was over there? What would you be saying to me about opening the mall? Give us the chance to comply to what we want to be in that. We want to be one of the open people. So I was sitting here just so confused, like, how is it on break? We're just this close in each other's face. This gentleman cleaned this one time, no disrespect to him, but everybody else grabbed it and talked and got together. So they're violating, but we want the chance to do right. So why can't we open? Who allows us to or not to? I mean, when you go in Home Depot, they stand there and count you. But when you go in Home Depot, it's more people in Home Depot than it is sitting here. So I try to figure if it was my business and I was sitting here, I could have finished someone had them in and out. So and trying small business loans, no, we can't get the loan. Your applications were not taken because we're giving the money to the bigger people. So what do we do to catch up on our rent to do what we need to do? So I'm confused. I couldn't even join in on this. This was horrible to sit here and watch this and watch us lose our jobs in our businesses and our employees because we don't have 20 and 50 employees. It's just us. But we're entrepreneurs. We deal what most people can't do. We don't work for nobody. We work for ourselves. Give us the chance. So I feel like right now the Governor Polis and whoever has that control, you got your knee on our necks. We want to go to work. Please let us.
Thank you. We've all expressed our...
Can I ask just one question?
Yeah, hang on one second. We have all expressed our displeasure with the way the state and in particular Governor Polis has handled all of this. We think it's not been appropriate. Commissioner Williams.
Just can you tell us what your business is in Citadel?
I am a business salon in the Citadel Mall who has taken care of me even through my background, everything I have ever done. And they have truly supported me. And I want to give the chance to give back. And when we apply for those loans, no, you're down here because we don't, how many employees do you have? How many of this, and then some of my employees are self-employed. So we don't get that loan. We have to take out a personal loan. Then they say, the first question, are you employed? It's a joke. It's like, I want to be employed. I want to do this. So I just don't understand what's the protocol that you're asking for the gyms and things like that. Why can't the mall do that? We know how to take care. The mall's been taking care of us all this time. We know how to comply. Their staff is awesome, so why can't we get a chance to show it? So when it just said that little section of mall closed, then y'all just went to the next thing. We want to be happy about a graduation. We want to be happy about festivals and gyms and family reunions. We don't have the money. We're losing our houses, our cars, our kids that are graduating. Congratulations. No, we want to be able to pay and do the things too. But it's just, how can he keep his knee on our neck? How? When he lets Home Depot open, he lets a bar open. No disrespect for anyone in here who has bars and everything else. What's the difference? What was the difference from our break? And everybody was this close talking to each other. I have my mask, I have my gloves on. This podium, 5 people talked around this for like each person came up here. Even the doctors. It's like, okay, but you're asking us to hold us to the wire. Well, give us a chance. So I don't know who's in charge to do that. I don't know if it's you or if it's the governor, but we should be able to have the chance. Open our malls.
Well, thank you.
I appreciate it.
Thank you.
Hello, my name is Michelle Tellerico, and I own the Picnic Basket Catering Company in Colorado Springs, and I am representing the special events industry. I certainly can't follow up that much passion. Thank you so much for your words, but what I can echo is that on behalf of the small events, special events industry, which are comprised of tons of different types of folks, photographers, DJs, videographers, florists, cake shops, caterers. There are so many people that make all of us up, and I would agree that we we all need a chance. We all, for months now, not just because of this order, not just because of all of the work that we very much appreciate everybody has been putting in, from the health department to all of you folks, and the folks with our chamber and EDC. But we do hold ourselves to a high standard. We want to do only the best things for our business and for our employees. And we are doing safety measures far beyond some of the things that were suggested here. And I would just encourage you to please encourage others to recognize that the small events industry is a very powerful sector in this whole cog, and I appreciate very much us being allowed to be a part of this larger variance. But in weddings alone in the state of Colorado, over $1 billion was spent last year, just weddings. That's such a small fragment of what special events are. We have over 32,000 people that work in just the wedding event industry. 80% of all of our small businesses that are in our industry have lost at least 60 to 70% of their business. Every minute that goes by, we are losing an opportunity to work together. We're all better when we are working together, and we need to get our venues back open. We need to get, and those are both of a public and a private way that I'm speaking about, and we need to very much thank you and really tell you how much we appreciate your consideration to take this up to the governor's office, because this is a minute-by-minute struggle that we're all facing. And so I thank you all for all of the efforts that everybody has put forward. Thank you for your time.
Commissioner Vanderwerf.
Thank you, Mr. Chair. Michelle, I just wanted to express my appreciation also, as you know, but now this is for everybody else in the room. You know, you and I have been working together probably about a couple weeks now in working on a variance request for special events, and I appreciate very much that Public Health received that, looked at it, looked at all the other variance requests that they have gotten, and have decided that we do need a new approach, one that doesn't have the actual numbers caps, but goes to a percentage of occupancy, and that kind of an approach is going to, as you know, will be immensely helpful to your companies that you represent here. That I think, you know, it took us a little time, but it was essential so that we can get to a place so that the companies that you represent can survive this year, because as we all know, everybody's business cash flow has been harmed this season. So the goal here is so y'all can survive this year so that you can be with us next year. So I just want to express my appreciation to you and to your team for working with us to deliver a variance that is now embedded in this comprehensive variance. So thank you very much for doing that.
All right, who's next, please?
Good morning, ladies and gentlemen. My name is Tina Cook, and it's a privilege to speak to you this morning on behalf of the dance studios of El Paso County. I would like to thank our El Paso County public health officials. The collaboration with public health and the community to find innovations that allow for our economy to open with best public health practice has been remarkable, and we are grateful to them for working with us. I'm the owner of a faith-based dance and performing arts school serving over 1,000 students by providing extracurricular activities in dance disciplines, including ballet, jazz, tap, theater, and more. At my dance studio, we're training the whole student, body, mind, and spirit. There are many benefits that come through dance and the performing arts, but it is our mission to train our students to use their gifts and talents to bless others in the community and beyond. We're about more than dance. During this pandemic, our studios have had to close our physical doors. Most of us switched to online or distance learning, which has been an option in the interim. Just this past week, many of us were able to open in a small capacity with 9 students in a class. This is a small step, but it is not economically sustainable. And when you are serving 1,000 students, it's almost impossible. Our kids are hurting. They are lonely and feel disconnected. Our dance studios are a safe place for kids to find joy and express their emotions. The third place, a concept by sociologist Ray Oldenburg, explains how people seek community in a place that is different from home or work, or for our kids, that would be home and school. Social science tells us that the importance of this third place is key to allowing children to grow into their best selves. Third places are places where people can cultivate relationships and pursue their passions. At the studio, the third place means it is like a second home, the place where students can go and always belong. It's a place of connection. The nature of our business is such that we provide a registered instructional activity. We have the ability to effectively limit our class sizes within the requirements of our county, minimize crossover of visitors by having set arrival and departure times. We can keep students within same or similar class groupings with the same teacher on a regular basis, and we're accustomed to following robust protocols to ensure careful adherence to health and safety considerations, as our students' safety and well-being is one of the cornerstone values of our studio. We believe that dance studios in Colorado Springs can open in a safe and responsible way. Each business owner has worked on a preventative and outbreak plan, as the health officials have been working on this variance. We hope that you will consider this variance to open dance studios in a greater capacity so that we can continue to be that third place for students and contribute to a thriving performing arts culture in our community. Thank you.
Thank you. Who's next, please?
Hello. Thank you for having us here. We're the management team for the Citadel and Chapel Hills Mall. Ed Bean is the GM for Chapel Hills. Kurt Rulecki is the GM for the Citadel Mall. I am the VP of leasing for the company. So, as you heard one of our passionate tenants speak, it's reality. We have not been able to be open when other retail opened May 1st. We were prepared to be open, but at the end of the order, we were excluded in closed malls with given no guidance. We appreciate being added to this variance. Bob Cope, thank you very much for adding us. We have a lot of locally owned businesses within our doors. We desperately need to be open for our tenants. We appreciate you taking the time to hear us. Thank you so much.
Thank you.
Thank you. Who's next?
Good morning, Commissioners. Thank you so much for the opportunity to speak on this incredibly important variance. And thank you guys and also everybody at El Paso County Health Department for all of your leadership, guidance, and hard work during these really difficult times. My name is PK Knickerbocker, and I'm the director of Pikes Peak Region Attractions Association. We are one of the oldest destination marketing organizations in Colorado Springs. We represent 26 local attractions, both world-renowned and a lot of local treasures. For over 47 years, we've been using the combined strength of our shared resources to navigate good times and bad. Since they closed, we've been working together to plan and prepare for reopening. Together, we created board-approved safety guidelines, wrote an attractions variance with the help of Commissioner Vanderwerf, and we submitted that attractions variance to the Health Department on May 23rd. I have worked with all of our members to fine-tune our safety plans, accounting for each attraction's uniqueness. Our association represents hundreds of years of experience in the leisure tourism industry, and as such, acts as a forum and sounding board for all members. We are able to collaborate, share information and resources, and ensure that all members are following the guidelines agreed upon by the association's board. Many of our members are longtime family-owned and operated businesses. These are people that live in our region, they raise families here, care for their elderly relatives, and they give back to our community. In these family-run businesses, it's common to find family members, including children and grandchildren, behind the counters, helping the visitors. So we know that these attractions are motivated to safeguard the visitors and their employees. My association represents generations of hardworking Coloradans, and they deserve the right to open their doors under the responsible guidelines set forth in today's proposed variance, as well as their specific guidelines that serve to cover each entity's specific needs. If we fail to get them open and open soon, some of them will not be able to reopen. I'm here today on behalf of my members, but this is also vitally important for our local economy. Tourism brings billions, with a B, billions of dollars to our local economy, and millions in tax revenues. It's the third largest employer in our region, providing hundreds of millions of dollars in earnings. When visitors come to the Pikes Peak region, they have three questions. Where am I going to stay? Where am I going to eat? And what am I going to do? Right now, question 3 is an unanswered question. I urge you to pass this variance today and give these folks a fighting chance to save their businesses and put our local economy back on the recovery trail as well. Thank you.
Thank you. Yeah. Commissioner Vanderwerf.
Yes, thank you, Mr. Chair. PK, I also want to thank you for the work that you've done. As you know, we've worked together the last couple of weeks working on that variance, and I, similarly to the special events activities, this became another opportunity to get this into this broader variance and work on even a little bit more freedom of movement in the broader variance than even what we had originally worked on with your variance. So thank you for you and your industry stepping up and working so hard with public health and with us to get to a standard that will allow you to reopen. And I'll reiterate your point. If we don't do this for your companies, for the attractions industry, some of them won't open next year. So this is critical. Thank you.
Who's next, please?
Good morning, and thank you for the opportunity to be here and speak with you this morning. My name is Kent Sturman. I am the director of the Pro Rodeo Hall of Fame and Museum of the American Cowboy. We are members of the Pikes Peak Region Attraction Association, and I am proudly serving that organization this year as its president. As PK said, we represent 26 Pikes Peak region attractions, 21 of which are located right here in El Paso County. One of the main values of our association is our shared knowledge and experience, the opportunity to work together not only to promote this region as a destination to the world, but a networking opportunity to share ideas, collaborate on events, and work together to promote this great region. Our members have come together to share information about loans and grants, new regulations, and we have met remotely once a week since this pandemic has shut us down. We've all agreed on the policies and safety regulations so that our visitors will know that they're in safe, caring hands when they visit a Pikes Peak Region attraction facility. Times like this are exactly why our association was formed. For over 47 years, we've worked together to collaborate and hold each other accountable in the industry. Excuse me, and when we know that we're doing things the best that we can do, then our neighbors and our communities will feel safe. We're ready to open and welcome our guests to our facilities from all corners of the country and all corners of the world. They come to this beautiful place that we all call home and love. As the director of the Pro Rodeo Hall of Fame, I've lived in this community for just under 9 years. I chose Colorado Springs as my home and the place that I wanted to work. And prior to this pandemic hitting, the Pro Rodeo Hall of Fame was considering a multi-million-dollar expansion and remodel. We're unable to do that now or move forward with that, but we wouldn't do that if we weren't committed to this community. Since the Hall of Fame was built and first opened its doors in August of 1979, nearly 41 years ago, we have proudly called Colorado Springs and El Paso County our home. So we've been good to the community, and the community's been good to us. Our businesses and our employees are hurting, and we need to open. And I know everybody has been hurting through this horrible, horrible situation. But we're ready to commit to these regulations. We are committed to the safety procedures outlined. We thank the health department for working with us to get this developed. We're prepared to welcome guests to our facilities, both locally and those from across the country. We need your support, and we thank you for considering this variance today.
Thank you.
Good morning. My name is Grant Carey, and I am the general manager of Cave of the Winds. Before I begin, I would like to ask that everyone who believes they're in the tourism business in Colorado Springs, please stand up in the gallery. Thank you. I come before you today as a representative of the El Paso County tourism industry, individual businesses, and all responsible citizens of El Paso County in support of El Paso County's alternative opening plan and safety standards. and to inform the El Paso County Commissioners that these businesses and their organization, the Pikes Peak Regions Attractions Association, which makes up a significant portion of the tourism industry and tax base for El Paso County, are being unfairly denied an opportunity to open their business, while other select businesses around the state, such as zoos, botanic gardens, ski areas, all are similar to us, have been granted the opportunity to open weeks or even months earlier. And these actions and delays of the El Paso County officials and the staff are ignoring the long-term economic impact as well as the national reputation of our community as a world-class destination for families and travelers, not to mention the long-term effect of the economic well-being of each individual tourism business who continues to be shut down. In addition, we seek to provide clarity to the commissioners so that none of our members are generalized, construed, or categorized as amusement parks or activities or venues that typically gather hundreds or even thousands of individuals in a confined or close proximity space or location for any extended duration of time, and thereby may allow for greater opportunity to achieve an infectious viral load. Rather, per the El Paso County Health Department, attractions shall be defined as indoor or outdoor places of interest visited by people for their natural, cultural, educational, historical, or unique entertainment value. We feel this is necessary to clarify, given our unique business classification as tourism and the multitude and diversity of other business types that may be incorporated within our core business classification, tourism. In short, we don't fit the norm. Allowing people to congregate in closed spaces over time carries inherent risks that must be acknowledged by those choosing to participate, despite the protection inferred from the preventative measures our industry has adopted. Therefore, we have encouraged our business partners to adopt additional safety and health measures for their unique circumstances and develop creative approaches to ensure the public's health and safety. Prior to this meeting, our trade association submitted to the El Paso County a set of guidelines along with a request for variance in the sectors of food and retail. Through this set of uniform guidelines, the El Paso County Department has been which have been adopted and ratified by our members to follow social distancing and public health safety guidelines designed to protect the individuals from brief or outdoor exposure. The intent of these protective measures is to limit or not allow time or contact to achieve an infectious viral load. Given the unique nature and size of most of our attractions and facilities, all attractions will limit their capacities to 50% or the occupancy necessary to maintain the applicable 6-foot distancing requirements. Furthermore, the current EPC Health Department alternative plan for safely opening and its guidelines will be monitored and incorporated. It is each business's intent to provide the community and the public's health safety while having the ability to be a viable and profitable business in the community. We hope that our actions and attempts to address the county's concerns will provide the commissioners with the assurance necessary of our sincere effort to make our community as safe as possible to work, play, and live during these difficult times, and that the commissioners will not delay any further granting the reopening of our local tourism industry and businesses. And furthermore, we hope that you will assist us and our individual businesses by informing the state's offices and the Colorado Department of Health of your approval of our variance request so that the state may not delay any further in the reopening of the tourism in El Paso County. Thank you.
Thank you. All right, about how many more folks do we have that want to say something? All right, looks like only 3. Oh, we have 3 online as well. Okay, maybe we have 7 or 8.
Okay.
All right, Mr. Price.
Good afternoon. Doug Price, CEO of Visit Colorado Springs. Not only is it lunchtime, but it's crunch time. It's time to move forward on this.
All right, you're done. That's no, I'm kidding.
And for anyone who didn't stand when Grant asked if you're involved or impacted by the tourism industry, the average family of 4 saves over $600 a year on their tax bill by the revenues that get spent by tourists that come to our region. As you all know, our region was founded on tourism and wellness. And this is a time like we've never faced before. And so I want to just, from the people at the mall to the people who are here with the attractions and the gyms and the transportation companies and everybody else, I stand before you today to say thank you for what you've done. I thank the El Paso County health professionals for everything and how serious you have taken this relationship, and I look at it as a partnership. And I simply want to say that we truly need to ignite the state to get this waiver up through and approved so that not an unnecessary day goes by that we can't do a wedding or have people at our attractions and truly keeping these family businesses working as well as making our visitors happy. Thank you all very much.
Thank you. All right, again, let's try this one more time. How many people are actually going to speak? Okay, 1, 2.
I have a separate issue. I just need
Okay, public comment there. We've got Dirk, that's 4, 5, 6, 7. All right, I'm beginning to think, let me pull my colleagues here, maybe perhaps just to make sure we give this all the thorough hearing that we want. Maybe we should break for lunch and come back. What's your feeling? Pressing through? All right. Yep. Mr. Draper, or whoever was going to be next.
Over and clean me up here, will you? This is the most important guy here, and in my business, the people that clean is gonna win, okay? We need to project cleanliness, go by the rules. I'm so grateful for you to be here. Thank you so much.
You're welcome. You're welcome.
All right.
You guys,
can you please state your name, sir?
Charles Murphy. My family owns Gray Line Tours and Pikes Peak Tours here in Colorado Springs. It's our 44th year. My grandchildren are 6th generation Coloradoans. On a side note, my family also owns and is a landlord at the Peak Theater here in Colorado Springs. You have a very difficult job, and you have a lot of people pushing you to open, and we need you to open. And we're grateful for you to get this variance up to the governor, and we think that the governor will approve it. And I'm just here to tell you how grateful I am that you are taking business as well as being considerate of those. So the last thing any of us in the business community want to do is to get anybody sick. And so we're looking for your guidance and your help in having this variance so that we can keep our businesses safe, our employees safe, which means our families safe, and our visitors safe. So in lieu of time, I just want to tell you how grateful we are for the hard work that you do on our behalf, and to keep it up. Okay.
Thank you. Who's next? Yes. All right, all right. We'll take this gentleman and then we'll take somebody on the phone.
Tom Haggard, Santa's Workshop. Just a brief question to County Health. While we are waiting on this variance, can we open our retail shop and our food areas that have already been opened under other variances already? Yes.
Yeah, and I don't know if it's more appropriate to talk to you offline, or can you answer it quickly?
Yes, you can, so long as you're applying with all the requirements for that particular sector.
Thank you.
All right, let's take somebody on the phone.
Hi, this is Kristen Robinson. I had sent in a pre-recorded message. Can that be played?
Oh, okay, how long is it?
It's less than 3 minutes.
Okay.
Would you rather have the message played, or would you rather just say it?
I can say it as well, whichever is easier.
Probably easier to do it that way. I haven't downloaded it.
Okay, I'll go ahead and say it, no problem. So I wanted to speak in regards to House Bill 19-1234, which relates to regulated marijuana delivery. This bill is very important to my family. My husband and I are both patented inventors and business owners in Colorado. We are considering opening a medical marijuana center in the Denver area in order to provide medical marijuana delivery service to sick patients throughout local counties. Just so you know us a little better, I have a Bachelor's of Science in Chemistry and for the past 20 years have worked in the field of computational drug discovery. My husband has 2 master's degrees and is a highly vetted combat veteran who served in Afghanistan. He was chemically injured during his service time and now uses cannabis to reduce his intracranial hypertension and lymphedema. After trying numerous pharmaceutical drugs over several years, my husband came to find that cannabis is the only medication that treats his symptoms without side effects. Other pharmaceutical options lead to muscle spasms, cardiovascular issues, and others. He now uses edibles and water-cooled vapor to take organic, low-THC marijuana strains that do not lead to any sort of head high. I would like to strongly urge the El Paso County members to opt into House Bill 19-1234. So I understand that some may have a concern that those under the age of 21 may be able to order marijuana online. I want to assure you that the state's firm seed-to-sale tracking system metric, METRC, would make this impossible. The system incorporates ID scanners, barcode scanners for RFID tracking of all cannabis, sophisticated purchase limit alerting, and compliance labeling that will ensure that only card-holding medical patients will be able to order and have marijuana delivered. El Paso County should opt into this bill for several reasons. First, dispensaries that sell medical-grade organic marijuana are few and far between. In fact, we had had to travel almost 3 hours from El Paso County to purchase marijuana that is not filled with herbicides and pesticides that worsen my husband's condition. In addition, he cannot drive due to his illness, so we have to go together to the dispensaries and take turns running in to get our single ounce of organic marijuana while our homeschooled children sit in the car with the other parents. It would be much safer and convenient to have the ability to have his medicine delivered, which is why we want to offer this as a service throughout the county. There are countless patients like my husband who struggle with leaving their home, as well as those with severe illnesses such as cancer and Parkinson's, and even single parents that are medical patients who desperately need to have quality cannabis delivered directly to their homes. Again, I urge the county to opt into House Bill 19-1234. Thank you.
Who's next here?
Good afternoon. I'm Dirk Draper. I'm President and CEO of the Colorado Springs Chamber and EDC. I just want to say thank you to the county's health department for putting this together. I think Kenny Hodges probably had his hands on the keyboard for a majority of this. It's a great measure in terms of providing efficiency and a good comprehensive view to get us past the slow pace of industry by industry process that we've been through so far. In developing this, we reached out to probably over 100 businesses at least had an opportunity to comment on the draft. You've heard from a number of them today. The Chamber and EDC supports this. We encourage your support. We will voice our support to the governor as well in hopes that that expedites the process. We heard lots of comment today, but just want to say thank you again to the county for good work together, good partnership on this.
Thank you.
Good afternoon. My name is Aaron Winter, and I am the General Manager for the Flying W Ranch here in Colorado Springs, also part of the Pikes Peak Regional Attractions Association. We are highly in support of obviously getting open. 8 years ago, we were destroyed in the Waldo Canyon fire, and just so happened this year was our grand opening, and we are looking forward to getting reopened. And just want to say thank you to all of you, everybody from El Paso County Health, as well as everybody from Pikes Peak Region Attractions. We are definitely ready to move forward.
All right,
you again.
Thank you. Yep. I look forward to being at your grand opening. All right. Thank you.
Who's next? All right, we'll go to the phone.
Hi, good afternoon. My name is James Anderson. I'm General Manager at Great Wolf Lodge, Colorado Springs. First off, I want to thank Dr. Johnson and the County Health Department for all their collaboration and guidance during the time as we've put this plan together and is under review regarding the water park section. Excuse me. For Great Wolf, safety has been a foundation for which we've been built on. We have families that come to the county and get to enjoy themselves. We want to make sure that they're provided with a great experience, but more importantly, a safe and clean one. Since we decided to close our doors a couple months back, we've worked with a number of industry experts, the medical community, and a number of trusted business partners to kind of develop a plan on how to operate. And we've come up with a very strategic and well thought out process in terms of how we're going to work with our families that come to visit here, and more importantly, our PAC members that come to work with us and for these families that enjoy the Great Wolf Lodge and all it has to offer. And we've developed a number of core guiding principles to make sure that we're able to reopen, but do so in a responsible, safe manner for all to enjoy and to take part in. As it pertains to the water park specifically, under the guidance, it looks at pools individually having a capacity of 50% or 50 people. And what we're asking for is to look at the facility itself based on the general square footage and the natural separation of amenities that we have within the water park. We're able to create a flow from each of the particular pools. We can minimize the amount of occupancy in each one. We worked very closely with a industrial engineering group to make sure that the areas within the water park can be open and provide the distancing measures that are so critical right now. That includes pools, slides. We actually even monitor we'll be monitoring the occupancy into the water park in real time through a camera system that allows us to know the flow in and out of the water park. And so we're able to maintain the distancing of all those sections, including seating, keeping it only to minimal chairs for small family groups, and working on those educational pieces with our guests and our PAC members as well. I don't know if you have any questions regarding the process.
Any questions? All right, seeing none, thank you. We have one more person online.
Thank you.
That's it? Do we have anybody else that wants to speak on this agenda item? All right, we will bring it up here to the dais for brief deliberation and a vote. Brief deliberation and a vote. Ms. Sego, do you have anything you wanted to?
I will be brief. I'm asking for one additional change to the document to be consistent with the change we made to the symptoms list when it comes to monitoring employees. If I can have the overhead, that's what we discussed adding. And I would just like to make a consistent change in section D on the next page. So employees must be required to stay home when exhibiting any symptoms or signs of sickness that can't be otherwise explained.
Okay.
Thank you.
I like it. All right, could I have a motion? Commissioner Gonzalez.
Thank you, Mr. Chair. I appreciate all the great work, hard work on this, making this happen. The governor shut everything down, and we know what it's done to the businesses, to residents, employees, and employers, and it's been a long road to get us to reopen. Everybody knows I've been trying as hard as possible to expedite the reopenings, and what I see here, the broad base is what I appreciate, and very importantly, up in number 2, that authority for local control, so that we can then recover that local control and then make additional openings as appropriate based on our local experience. And so I'll be supporting this today with those changes.
Commissioner Vanderwerf?
Yes, thank you, Mr. Chair. And I will also be supporting this. There are a series of things in here that I think are critically important, really a change in approach, thinking about percentages of occupancy versus maximum caps. And this is a better approach for our community, really any community in the state of Colorado, because we do have venues that have huge numbers that they can handle and while still being able to maintain proper health procedures and social distancing. So I think it's very important that we pursue this approach, and there is a trend in this document to move more towards what I have often referred to as a coronavirus safety standard, because there are references to other documents in here that I think are better established. I believe that's an excellent approach. I look forward to us moving forward to that. And it's been really difficult for everybody. The governor, issued the 5th Amendment on Tuesday last week and the 6th Amendment on Friday, and there are changes in there that have implications in a variety of different ways to include our previous variance approvals and any future variance approvals, and that has been very, very difficult for everybody. So I appreciate everybody's trying to work towards that. And I will make one last comment, and that is, this is so important that we do this. If we don't do this, if we don't get these companies open and get to a measure of cash flow while also maintaining proper safety, many of them won't be back with us next year, and that is so important. So with that in mind, would it be okay if I made a motion?
Sure.
Okay. I would like to make a motion to approve the El Paso County Alternative Opening Plan and Safety Standards for gyms, athletic training facilities, theaters, indoor malls, indoor and outdoor activities, attractions, indoor water park at Great Wolf Lodge, libraries, and small private special events, with the following modifications to the language. On page 3, paragraph C7, adding the words, and I quote, "that can't be otherwise explained," between the words symptoms and must, and on page 9, paragraph E5, removing the words pool tables in pool halls, and on page 9, paragraph F, removing the words amusement park in the first paragraph. And then also on page 4, following the similar language from page 3, using the words that can't be otherwise explained, this would be applied in section D on page 4. Those are the modifications to the words.
Commissioner Bremer.
Thank you, Mr. Chair. I will second that with some comments, if I may. I gave my great thanks to those who pulled this together at the Health Department earlier in my commissioner comments, but I really wanted to thank also the industry leaders and those who spoke on behalf of business owners and let us know what it was that you were willing and able to do. You helped, in many cases, your industry helped write these regulations, and I just appreciate your willingness to come to the table and let us know how you could protect the health and safety of your employees and customers, and we certainly trust you to know that best. So that also brings up the fact that, I want to thank my colleagues because I know each of us has been incredibly hands-on, sometimes with different sections or different pieces of this that had particular relevance, either to our district or to us. And so I think the final product ended up very much being the voices of all those emails and calls that we as commissioners have received, because your commissioners then were very hands-on in communicating with the health department what sectors we were hearing from and exactly what we were hearing from you all that was reasonable. So the final product, we hope, is really something that allows the business owners, whether you're explicitly mentioned as a sector and called out with specific guidelines in this document, or whether you kind of fall under the catch-all. We are, I'm hopeful that you realize that this is, you get to determine how you can safely comply, and we've put some reasonable guardrails around that, but you get to decide how you can operate your business. I think if you haven't seen Commissioner Williams' very well done editorial in the Gazette today, she talks about how the commissioners have really been put in the position of choosing winners and losers by doing these industry by industry variances, and none of us at any point in time have enjoyed being put in that position. And so I feel like this variance definitely goes a long way with really helping our community, no matter what type of business or line of business you find yourself in. It goes a long way for helping you be able to get that business up and running and understand a few safety precautions, but not telling you exactly how you have to do that, encouraging you to have some safety and health precautions. And many of you have already taken it upon yourselves to consider those anyway. So I think, those, on another note, the goal was always for these guidelines to be less restrictive than those that we are seeing come down from the state. So with that in mind, I hope that we have provided some good guidance, and one that allows business owners to run their business like they would like to. And then finally, I love the local control. We talked about it, heard about it early from Dr. Kelly, about how the Public Health Department now has local control to determine things like graduations, and we heard the very positive direction they're moving on, allowing those to open up a little bit. And I'm excited about the possibility of local control in continuing to determine whether restrictions need to be in place or not, with really great data, and allowing businesses to open up under what's reasonable for our area, and also just understanding that El Paso County is full of incredibly conscientious, hardworking business owners who really want the best for everyone around them. And so we're trusting you to do that, and we're giving you the leeway to go open and run your business in reasonable and smart and measured ways. And I'm just very honored to be a part of the process that has taken so many people's wishes and hopes and dreams, and pulled them together in a way that I do hope our state government will realize is best for our community.
Thank you. Commissioner Williams.
Thank you. I appreciate those comments. As I expressed in an editorial in the Gazette today, this is not my idea of a free business environment. I believe our businesses, our individuals, our public, they truly know what's best for themselves. I don't know what's best for your business. I don't know what's best for the North Pole Santa's Workshop any more than I would for Cave of the Winds. And to move away from the position where we are granting permission to businesses to operate so that businesses can get back in the business of competing with each other. And that's what we're really trying to do. We don't want to have the small gym versus the large gym, or the small hair salon versus the large hair salon. All of these are really, have been really tough emails that we've all received, and business owners that we've spoken to who are on the verge of losing their businesses. We heard from one individual today. It's hopefully this is a big step forward so that we can start opening our economy and get our businesses and our citizens back to work and try to gain some normalcy back to where we were a few months ago. Thank you.
Thank you. I certainly believe as a community we've been leaning forward in the seat since this whole crisis kicked off. Had some problems early on, with one particular incident or one particular happening that caused us to have a much greater spread of this virus and much greater deaths than we otherwise would have had. And we got after it right away. And I think in large part because of the way we've done things as one of the two largest counties in the entire state of Colorado, I think that we have been the example that the state has followed in numerous circumstances. And I think in some respects that's a good thing. I mean, I wish we didn't have to be the leader for the state. I wish it would be the other way around, but unfortunately that has not been happening. And so I guess, this is something that our health department and business community and hospitals and Board of County Commissioners has taken on, and it's something that I think has been good. I hope as we continue to move forward, things continue to progress the way that they have been progressing, and we can continue to request these variances. Hopefully this local control piece will be granted, and then we can just start having that authority to ease restrictions on our own. I think that would just be the greatest thing of all. But I can't tell you how much I appreciate all of the work that the Department of Health has put into this, the medical director, our deputy medical director and coroner, all of the business community, the Chamber of Commerce, Visit Colorado Springs, everybody that's been a part of this to get us where we are today has put a tremendous amount of effort into it, thinking about the economy while at the same time thinking about the safety of the citizens. So thank you for that work, and I'm going to be an incredibly proud yes on this variance request. And then I will sign the order the minute we get this vote done, or sign the variance request to get to the governor the minute we get this vote done. So with that, I will call the roll. Commissioner Brimmer.
Aye.
Commissioner Vanderwerf.
Thank you. I call upon the governor to approve this once we send it forward. As written, we do need this variance for our community. I vote aye.
Commissioner Williams.
Aye.
Commissioner Gonzalez.
Aye.
And the chair votes aye. That passes unanimously. Woo-hoo.